Hello, I am Dr. Suresh Sawardekar, consultant physician and diabetologist, practicing in Nanavati Hospital and having clinic in Santa Cruz East. Today, I am going to speak about CPR, that is cardiopulmonary resuscitation, in our day-to-day life and how it is important to save a life of a person who is lying on the road. Thank you.
Good morning, everyone, and thank you for coming here. This is indeed a privilege for you to this kind of program that Dr. Sawardekar and Dr. Sani and everyone has put together. A little bit about the incident. Actually, this is more of an from Chhatrapati Shivaji Maharaj स्मारक समितीच्या तर्फे हे एक सगळ्या आपले जे कोचेस आहेत, आपले जे डॉक्टर्स आहेत, आपली ही जी एक फॅमिली आहे, PTKS is like a family. Here, and I would like to correct what Umesh said. There was no panic situation, and that is the beauty of it. Everyone knew what they were supposed to do. The doctors, our coaches, and that is why Mr. Jain is here amongst us. So, slight correction. If the doctors, if the coaches had panicked, then we would not be sitting here today. So, a big round of applause for all the coaches and our doctors. Words, there are no words that I can say to thank all the doctors. म्हणजे मी ऋणी आहे.
I had given the CPR in ICU only. It was possibly 5 to 10 years back, though I have worked in ICU for 15 years. But in between, I left ICU and I am doing now my ward and OPD practice. So actually, actively, I am not involved in giving CPR, to be very frank. But suddenly, being an intensivist in the past, and this happened, so immediately I ran towards him and not knowing anything that I just started CPR, started giving compression till I got tired, and this should not be done in CPR also. I gave mouth to mouth respiration without thinking of anything, and there was blood from his mouth and the blood even went into my mouth. So it was just a spontaneous reaction. Usually it has to be through the mask, proper mask किंवा ट्यूबने द्यायचं असतं CPR, to be very frank. And that gave us new insight that we should be keeping up to date about the CPR, and everybody should know about the CPR. Not only doctors, it is not a doctor's job to do the CPR on the road or in even a social gathering. Doctors will do the CPR in ICU setup or in hospital setup. But it is when we do 100 CPR, only the 9 people are saved. फक्त 9 लोक जिवंत राहतात म्हणजे we give out of hospital CPR. That is very rare incidence of giving a life to a person. So every one of you can give a life to a person if you are taking initiative of giving the CPR. Yeah. And so this movement will start now from here, and everybody will learn CPR. Let's see through the PPT presentation how to do CPR. So the CPR का पूरा नाम है कार्डियोपल्मोनरी रिससिटेशन. इसका उद्देश्य है हृदय की धड़कन और सांसों को दोबारा चालू करना, और ये जब व्यक्ति को सांस रुक जाए तभी ये धड़कन बंद होती है, तभी देना जरूरी है. इमीडिएटली इफ समबडी फॉल्स अनकॉन्शियस, वी शुड नॉट स्टार्ट CPR अनलेस यू सी हिज पल्स एंड ब्रीदिंग. अनलेस उसकी सांस और पल्स जब तक आप नहीं है तो ये CPR दिया जाता है. सो व्हाई टाइमिंग इज इम्पॉर्टेंट. सी गिविंग immediately CPR is very important, because when the heart and lung stops, the victim has only 3 to 5 minutes, okay, for brain death to start to occur, and if no CPR is performed, brain death can start occurring. So जब हृदय और फेफड़े का सांस बंद हो जाता है, तो यदि CPR नहीं किया जाए तो पीड़ित के पास केवल 3 से 5 मिनट होते हैं, जिसके बाद धीरे धीरे मस्तिष्क की मृत्यु हो जाती है, और 10 मिनट तक CPR न होने पे पर्सन विल बी डेड. सो व्हाट आर द सिंपल स्टेप्स फॉर CPR? Like approach safely. See, approaching safely is important whenever you are in whichever is place. So you have to approach safely, check response by asking the person, hi, how are you, or are you awake, what's your name, like telling him or asking him, check the response whether he is awake or no, check his pulse and shout for help. Very important. You can't just start giving compression immediately. Shout for help is very important. So call for emergency and start the chest compression, very important. Then open the airway as Dr. Sane told, and then give 2 rescue breaths. So after every 3 compression, you have to give 2 rescue breaths. So, basic life supports में sequence is important. See, airway, breathing and chest compression was initial. So now we go for compression, then make airway patent and then breathing. Compression, that is chest compression. Airway, making airway open. So this is the sequence that we should start. Compression, that is push hard and fast on the center of the victim's chest. See, so what is high quality CPR? Chest compression at appropriate depth of at least 2 inch, that is 5 to 6 centimeter deep, and then at least 100 per minute, 100 to 120 or 80 to 120. So at least 1.5 chest compression in a 1 seconds. Push hard and fast method, allowing complete recoil of the chest after each compression. After giving chest compression, you should allow the chest to recoil again. Okay. So this is the position of on mannequin. This is shown here. Place the heel of one hand on the center of the patient chest on the lower sternum, that is lower part of the chest. You should keep the heel of your palm, and keeping one palm over the above, other hand on the top with the finger links. Position body directly over the patient chest and keep the arm straight and elbow locked using the body weight to compress. So opening the airway by the head tilt and chin lift is important. Opening the airway, it is shown here already. You should flex the neck and close the chin so that the airway gets open. ये पोजीशन ऐसा होता है एयरवे का, जब when it is extended it gets closed, so when you flex or make straight it gets open while after closing the chin. So 2 rescue breath after 30 compression. After giving 30 compression, we can give 2 rescue breath by giving mouth to mouth respiration or through the mask. Every breath should be delivered over 1 second with any delivery method, and good breath will cause the chest to rise. So compression to ventilation ratio 30:2. After giving 30 chest compression, you have to give 2 breath by at least mouth to mouth respirations or by mask or whatever is available. So 5 cycles of 30:2 compression should be delivered, and then you should check the pulse of the patient. After has a cardiac arrest and lying over there without pulse and respiration, you should start immediately, see around whether something is not falling or you will not fall, and start the chest compression, give 30:2 mouth breathing and call for the help. That is important. Prior you should call for help and call the ambulance and then start CPR.
Thank you so much. So I am an AHA instructor. AHA stands for like American Heart Institutions. That gives us the CPR guidelines. Every 5 years, these guidelines have been updated that how to give the CPR. Okay, so as sir has taken a beautiful session and everything is covered, so I might not repeat everything, but we are going to show the demonstration.
Victim has to be on a hard flat surface. Next time it won't be the swimming pool, it may be the office or whatever it is, like the person is sitting on a chair and he collapsed. So you can't check tap the shoulders and everything, because we have to save brain. Because brain can survive only for 4 to 6 minutes maximum once the circulation is stopped in the body. What a sir was telling about the circulation, right? Okay, heart pump होता है तो body में पूरा circulation चला जाता है. Stroke. Have you heard about the stroke? So उसका sign and symptoms क्या है? Weakness, paralyzed. Okay, so suppose I am this side and I am tapping on one shoulder only. So what will happen? Hello mister, are you okay? Are you okay? But he is suffering from the stroke and he has become unconscious. He will not able to give the response to us. Though maybe he is having the pulse and all that. So both your hands. Are you okay? Are you okay? 2 to 3, not more than that. Do not waste the time. Immediately call for help. Then next is checking the pulse. So though if you don't know to check the pulse, or even someone is not confident enough to check the pulse, no worries. I'll tell you how to check. If you feel your trachea, this is the trachea, okay? So in the 2 centimeter in the groove, okay, just 2 fingers of the fingers, yeah, just right hand or left, whichever, and 5 to 10 seconds. As like sir said, we should not waste the time. So 5 to 10 seconds, okay, you have to check the pulse simultaneously the breathing. So your position should be like this. Now why I have to lean this? Because I can see the chest rise like that also. But when you lean down, you will do the look, listen, feel. Okay, so what is that? Look for chest rise, feel the pulse and listen the breathing sound. Because कभी-कभी क्या होता है? This is not a normal breathing. Yes, ma'am. Okay, so this is an agonal breathing. So if the agonal breathing is there, but obvious patient is going to lose the life. Okay, so that's not considered as a breathing. So you must start the CPR. Pulse mili, nahi mili, that's no problem. But where to keep the heel of the palm? Most important is the compression. You are seeing the sequence C, A, B. Right? The first is C, that's compressions. Right? So your heel of the palm. देखो आपको हाथ रखना है मतलब ये पोर्शन नहीं, दिस इज अ हॉलो पोर्शन. ओके, सो हील ऑफ द palm मतलब ओनली दिस पोर्शन. सो हील ऑफ द palm, आई एम नियर टू द victim. Everyone is able to see me? Yes. Okay, so heel of the palm, center of the chest, lower half, interlock. Okay, now this finger should be up as you have seen in the video. If I am doing like this, so I am compressing the ribs as well. So you have to keep the only these fingers up, interlock and elbow outstretched as sir has told you. Okay, now I am not going to compress with my hands. Okay, it's a hip movement. So what I am doing, see, if I am doing this, I am not going tired because मेरे shoulder इसके ऊपर weight नहीं आ रहा है. मेरा weight किधर है? ये मैं stand still हूँ, मेरा कमर के ऊपर है. From कमर से आपको movement करनी है, so you will not get tired. Okay, so now I'll give the 30 compressions. Okay, and then 2 breath by mouth to mouth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. Done? So this is a rhythm what we maintain. Shouldn't too slow, shouldn't too fast. So I'm pushing as sir said. So it should be 2 inches if it's in inches or 5 centimeter, but definitely not more than 6 centimeter. Now why? So this mask, pocket mask, you will get it in a pocket mask. Okay. So it has the one-way rebreather where we give the breath. So it won't, the patient's exhalation, it won't come to our mouth. Okay, and it's a safer. Okay. So this is narrow portion. So nasal bridge, हमारा nose यहाँ पे narrow है. So you can place it first on the nasal bridge. Okay. With these 2 fingers, you have to hold the mask like this. Okay. This 2 fingers and these 3 fingers on the forehead. So you can do head till chin lift. Your thumb, you have to compress the mask against the face, and then you have to blow. See, you see the chest rise. Okay, so just to see the adequate chest rise, 2 breaths and then again starts it.